My name is Harold Rutledge. I am one of the physicians in this hospital that provides pain management services. I went to college in Lexington at a small college called Transylvania University, and then I went to medical school again in Lexington, and I have done 2 residency programs at the University of Kentucky. The first was an anesthesia residency, and the second, about 8 years later, was a family practice residency, both at the UK. I graduated from an anesthesia residency program in the mid-1980s. I practiced anesthesia in a private practice at a local hospital in Lexington. For personal reasons, I elected to leave anesthesia and actually thought I wanted to be a real doctor, and went back to UK to do a primary care residency in family practice. I spent my first year at the University of Kentucky, and being a little Eastern Kentucky hillbilly, it was just a large place. I was fine socially and all that, but the classes were 200 to 300 students, and I did okay, but not great, and transferred to Transylvania and was fortunate to have a couple of professors that were instrumental in really changing the way I viewed things. They were very interested in me personally, but also the small group that were pursuing medicine, and they really made a big difference. And I excelled at Transy, and I think there were 11 of us in my class that applied to medical school, and 10 were accepted at various places around the country, most in Kentucky. The one that did not get accepted that year actually was accepted for a position in medical school the following year. So I really attribute a lot of that to those college professors. You know, I think the best thing that I like about my job is when I get the feedback. It doesn't happen as frequently as I would like. Pain management is a kind of a difficult area because we don't fix anybody, we don't cure anybody. We help manage a disease process that is very uncomfortable for a lot of patients, and it's those patients that really seem to almost get the home run. It doesn't happen often in this field. I do a lot more singles, occasionally doubles, mostly bunts and singles, but when you get that home run and you really made a big difference in somebody's life, that's a very satisfying and gratifying day. The typical approach in pain management is to provide a comprehensive approach instead of just a pill or an injection or a very simple fix. Managing people's chronic pain is really a multifaceted issue with a lot of psychological counseling, physical therapy, adjunctive treatments with chiropractors, physical therapists, and there's a whole lot of help that I get. I've been in this community over 20 years. Most people, although I'm sort of hidden in the pain clinic, it's in an isolated area of the hospital, and I rarely am in the hospital. I've gotten to know a lot of the primary care physicians and think I've established a reasonable reputation here to try. I think they trust me and to help their patients. I've done this almost 25 years and have a lot of experience prescribing pain medications. I believe I've been very careful with them, and I have limited the number of people I see on a daily basis so I can properly monitor their use of the medications and assess them carefully prior to starting those medications. We treat mostly pain from the spine, the low back, the neck, the mid-back, and we deal with that mostly with injections and interventions and those types of treatments, although I do have patients that some patients are still managed with pain medicine. The typical patient that I see has been previously seen by neurosurgery. The model in this community has been for 20 years that the patients with intractable pain conditions in their back, their neck, their mid-back have typically been referred to the neurosurgeons after they might have failed a session of physical therapy, or they strained their back, or they had some type of injury and they just continued to have pain. Everybody, of course, has experienced some level of pain in their lives. But when pain becomes chronic in nature, it can really take over. And we have debated in the pain world, and the gurus, as I call them, the national and international thought leaders, have actually tried to include pain as a disease process itself. instead of just a symptom of a disease, we've tried hard to change the view of pain. And in a chronic painful situation, that actually is the primary disease. The most gratifying patient is someone coming in thinking they had this horrible back, and perhaps their MRI does reveal quite a bit of degenerative process, but if you restructure the way they look at that and realize, well, this doesn't have to be the end of my life, I still can have a life in the midst of this, that's probably the most gratifying patient.